We're here to discuss self-breast exam, the importance of mammograms, and how often we should screen for breast cancer. Hi, I'm Dr. Maureen Koo. I practice obstetrics and gynecology in Los Gatos and Mountain View, and I'm here with 3 of my patients. And this is Leah. She just had a baby boy 3 weeks ago. And this is Sinead, and you had your baby a while ago.
Yeah, 2 years, and another boy 4.5 years. So.
And this is Florence, and she also just had a baby boy 3 weeks ago. Sorry. Breast cancer is the second most common cancer death among women, second to lung cancer. It's very common, especially after age 50. However, we do see women who are younger than 50 being diagnosed with breast cancer. The risk factors of breast cancer are depending on age, definitely. When you're over 50 or 60, the risk factor increases from 1 in 70 to 1 in 27, 28. But there are other risk factors also, like if you've never had any kids or the first child born after age 35, those can be risk factors, family history. And if you have other type of cancer like ovarian or colon cancer, there's some kind of cancer syndromes associated with breast cancer as well. However, there are only 20% of breast cancer that are associated with family history. So it is important that you are aware of other lifestyle risk factors, such as being sedentary or consumption of alcohol, more than 7 drinks a week. Those increase the risk of breast cancer as well. So it's important to realize those risk factors so that you can alter your lifestyle to decrease your risk of breast cancer. Mammograms are the gold standard for screening breast cancer. The reason is because it can detect very pin-sized, very small, non-palpable lesions that are very early stages of breast cancer. So it's very important that women 40 and older get annual mammography, because when you detect breast cancer in an early stage, there's a 5-year survival rate is more than 98%, and more than 90% of those will survive over the next 10 years. And a couple years ago, there was a new recommendation by the American Cancer Society, which was stating that they're only recommending women over 50 to have annual mammography. However, the American College of Obstetricians and Gynecologists, we are still recommending after age 40 to get annual mammography, because there are about 50,000 women each year diagnosed with breast cancer that are younger than age 50. So it's very important that you still continue annual screening if you're 40 and older.
Having kids over the age of 35 put you at risk. How does that put you at risk?
When you're pregnant, you have some hormone changes that protects the breast cells from growing, because the breast cancer is usually stimulated by the estrogen hormones, and especially like if you breastfeed, the estrogen hormone is lower, so that acts as a protective factor against breast cancer. Yeah.
Is there a time in the month that you would recommend is better for doing exams? Is it before or during or after your time of month? And what do you do if you're not that regular? That's another question that, I've had, because it's like I don't always know when to do it. Like, is it pick a day of the month or?
Yeah, the best time to do is a week before the period, or a week after. So if you don't have very regular menstrual cycle, you can try to do like a week after, or you can just pick a day of the month, like the beginning of the month or something. Yeah.
And do you recommend in the shower or on your bed or in front of a mirror? Like I've heard a few different, because I read and I got like different, I'm like, well, which one am I supposed to do,
So any condition that you can easily slide your fingers along, that will be good. You can even use like massage oil or something, and make sure that you have your arm raised on one side and then use the other side of the hand to examine it. The reason is because when you have your arms raised, the muscle is pulled back and you can feel the lump better. And then you just kind of go around in a circle. Okay. Yeah.
I have a friend whom about a week and a half, about 10 days ago, actually, she called me and said they found a lump. She found it at home and then went to the doctor, and they did some ultrasounds or x-ray. I don't know exactly what they did, but they have not done a biopsy then, but they said it wasn't, based on those tests that they did, it wasn't anything to be worried about. She's 40.
Okay.
Yeah.
And they did the mammogram and the ultrasound?
Yes.
Yeah. It depends on what they found in the ultrasound. Usually on the ultrasound we can tell what we call the solid or a liquid lesion, like a cystic or solid lesion, so a cystic lesion usually is more fluid filled, and that's obviously it's pretty benign, and usually those are called breast cysts, and usually they're stimulated by hormonal changes, especially around the period. The solid lesion is the one that we worry a little bit more about, but there are also other solid lesions that can be benign. If they see something like more solid, then I would lean more toward biopsy just to make sure.
Yeah,
sometimes you may not feel an obvious lump, but you see like changes on your skin, like any redness or even ulcerations, any nipple dimpling. Those are signs of the early stages of cancer or even the later stage. Yeah, especially bloody discharge. Those are not normal. You may feel pain. Some women tend to have breast tenderness, especially before period or during period, and those could be related to hormonal changes during the period. But definitely, if your pain persists throughout, the whole month, then you should be more concerned and just go see your physician about.
There's some controversy about MRIs, whether they're more useful or not. Yeah.
MRIs usually reserved for patients who are higher risk, like who have definitely more than one first-degree relatives, or if you've had previous history of breast cancer. With dense breasts, usually, you can just do, sometimes they can do like several different views, more additional views, what they call it. Yeah, they'll just like call you back for more view if they see that there's some shadowing or they don't see anything clearly. The downside about MRI is it can detect, it's very sensitive, so it can detect like really small, benign shadowing, and you can have a lot of false positives. So that may cause a lot of anxiety on the woman, and may create a lot of unnecessary biopsies.
For the younger women, breast augmentation, how often should you do a breast exam if you've had an augmentation?
You should still follow the same monthly self-breast exam, even with the implants.
Okay.
Yeah.
Okay.
And usually with the breast implants, we recommend like behind the muscle instead of above the muscle, so that you can do breast exams easily, as well as the mammograms.
Now, would that put you at risk though with the breast augmentation? Because I'm thinking about.
Again, it may obscure some mammographic views, especially if you have it above the muscle. But it doesn't necessarily increase your risk of breast cancer.
When do you recommend starting to get back over 40, when you're over 40 like me, to start the mammogram? If you want to start it that same year when you're breastfeeding?
When you're breastfeeding, we can't really do mammograms. We recommend that After you stop nursing, you wait for 3 months, and then you do
3
your
months?
mammograms.
Oh,
Yeah.
okay.
So, Dr. Koo, have you ever had a patient that is under 40 that has been diagnosed with breast cancer?
Yeah, definitely. I've had women as young as 30, and recently I've had a woman who is 35, and she was diagnosed by the physical exam by me in the office, and unfortunately she has very aggressive type of tumor, and she's in the late stage of the disease. Only 20% of breast cancer have family history, so that's why it's so important that you should consider other risk factors that we discussed about. Just want to send out a message for all the women out there. Do your self-breast exams, even early in age, starting age 14, and see your doctor for annual breast exams, and if you're over 40, get your yearly mammograms, and make sure you don't drink excessive alcohol, keep an active lifestyle, exercise at least 3 days a week, 45 minutes each, and good cardiovascular exercise, and also just listen to your body, and if you notice any changes that are unusual to your body, then make sure to go see your doctor.